So you must be thinking, so this video is going to be why I chose to become a CRNA. So yes, why did I choose to be a CRNA? Why did I go through all of the ups and downs, ins and outs to become a CRNA? Was becoming a CRNA really worth it? So in this video, we're going to talk all about that, so definitely keep watching. My name is Christine and welcome to a new video. If this is your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss anything. So you must be thinking like, hey, like Thrive CRNA, like you are currently a CRNA, and do you like it? You know, was it really worth it? And I mean, there's a lot of things that I can give you that I just want to spread to you. I just want to give you all the knowledge, all the power, and I want to be real. And, you know, and just to let you know, I chose to become a CRNA because it was the best fit for me, and I'm happy with my decision. I think it's important with any person going into any profession is to shadow. Really shadow, you know, a CRNA, even a medical doctor, an anesthesiologist, for example. You know, shadow an ICU nurse if you're a registered nurse to see if you really want to go through, you know, going into the ICU. I really believe in shadowing. Shadowing is so important. I feel you get to see the day in the life of a CRNA, for example, and it makes you experiencing like one hand, so you know for sure like, I actually want to do this, or you're like, I don't think this is really for me. And you don't want to spend time and money going into a profession that you're really not 100% into, because you don't want to do that. I would never want to do that for myself. I want to make sure that I shadow, I see it, I feel it out, and I'm like, this is cool. I like this. And maybe your first time, maybe your experience wasn't the best. Maybe shadow another time just to make sure with someone else and see how it is with their experience. Because sometimes you may shadow someone, it may not be the right mood, the right time, and it may not be the right moment. But then give yourself a second chance and shadow again and see how it feels. See how the environment feels. You know, maybe you need to go to another hospital, for example, or maybe another type of environment. Say, for example, you're interested in becoming working in a surgery center. Like, even though you want to become a CRNA, you're set on that. Shadow in a surgery center with a CRNA. Or maybe you want to do pediatrics. So then, you know, become a pediatric CRNA that really specializes in that area. Well, maybe you should go to a pediatric hospital and shadow a CRNA in that specific facility. To really give your head, you know, give your mindset, get your energy out there to really see it, feel it out, and know. Because for me, I love it. And for me, when I shadowed, for example, I worked in the ICU at NYU Langone Medical Center, and I worked in the ICU for a while. I was currently going to become a nurse practitioner. A lot of things changed in my life. I realized, you know, maybe it's not a best fit for me as an individual. And I said, you know, let me shadow a CRNA, because everyone's like, oh, the CRNA is awesome. And I'm like, let me check it out. And so I went to the operating room in my hospital. Like, I went to the chief CRNA at my hospital, and I said, hey, you know, my name is Christine. I work up in the ICU. I would just love to, you know, shadow a CRNA. If that's ever a possibility, you know, here's my contact information. I would love to just, you know, experience what a CRNA does, and of course, see what you do, you know. So I did that. I scheduled a day. I went, actually not just once, I went a couple of times to feel it out with different people. And it wasn't even that long, maybe a couple of hours here and there to kind of see the day in the life of a CRNA. Because you can watch YouTube videos, which are great, you know, if you can't go currently. But I honestly feel you need to go in person. You need to see it for yourself in person and talk to a CRNA. You know, because everyone has different questions and concerns that they have, unique to them. And so when you do go shadow a CRNA or even an anesthesiologist, honestly, we do the same exact thing. So I definitely feel that you should do either or. Ask your questions, ask your any kind of concerns, anything you can think of. Definitely get prepared for that. And you know, and a lot of CRNAs like me, I love questions. I love having a conversation. I don't believe any question is a bad question. I know some people may think, oh my God, I can't believe they asked me that. No, there's no question is a bad question, because you know what? You don't want to sit there always wondering and not knowing, you know? So definitely do that. And so when I shadowed a CRNA, I saw what a CRNA did. anesthesia management, for different surgeries, ventilator management, also remind me of ICU nursing, titrating drips, titrating anesthesia gases. It's very similar, catering your anesthesia plan to a specific patient, because every patient's different and every patient has different comorbidities, different age ranges, all different types of experience that they've had that's unique to them. So you can't give one anesthesia to every single patient. It's no such thing. It's like an art, and anesthesia is an art. And basically, like, for example, in the ICU, you may use certain drips, for example, on certain patients versus other patients, depending on their comorbidities. Also depending on the reason why they're why they're critically ill and what's going on with them, with their pathophysiology. So definitely take that into consideration. When you think about CRNA, it's a lot of it's kind of like ICU nursing. It's totally different. ICU, gives you that foundation to allow you to be very strong when you are becoming a CRNA, but it's different. But a lot of the skills, like working in a fast-paced environment, titrating drips, really knowing your pathophysiology, really knowing your patient population, kind of knowing even the medications they're on. You kind of know that as an ICU nurse because you deal with that on an everyday basis. Also, even utilizing, documentation, simple things like that. As an ICU nurse, you kind of know how to do that, and that experience is very important as well. So definitely take that in consideration when you're thinking about becoming a CRNA and shadowing and really feeling it out. So I love being a CRNA. So I've worked in many areas, I love variety. I don't like working just in one specific area and doing that every single day. Don't get me wrong, I can do it, but for me, my type of energy is to try different things, do different things, different patients, different surgeries, always changing. I like change. Change for me is the best. I love doing different things. So for me, that was always my thing, my goal. So when I first worked as a CRNA, I worked in a level 1 trauma center, and I saw a wide variety of cases, big cases, short cases, everything. And I felt it was good for me being a brand new nurse, brand new CRNA, working, because I got a lot of experience. And of course, when I graduated CRNA school, I felt very confident in my shoes. I felt like, don't get me wrong, I have a lot to learn and grow, but I felt very confident in taking care of patients, especially on my own. Of course, I loved working in a team approach. I love working with anesthesiologists and other CRNAs. For me, I love that, I feel knowledge is power, because we're always, bouncing information off each other, and it allows you to, I think, to give better care to your patients, For me, I always let my ego go, and I just, for me, I just want to take care of that patient, and really give them the care that they deserve. Some patients are easier to take care of versus others. It's not as that's their fault. It's just because maybe they're really sick and they require a lot more in-tuned anesthesia management. So that's the one thing that I really like about being a CRNA, and I just love pain management and different pain management techniques. As a CRNA, of course, you put them to sleep and you can give them IV drugs to go to sleep. But a lot of the changes in the research have been changing to more, there's an opioid crisis out, nowadays, and we're trying to do multimodal anesthesia, maybe doing spinals, epidurals, for specific cases, maybe doing nerve blocks. I know a lot of these things you probably have never heard of before, but it's so cool to me, and honestly, look into it, because you'll be doing a lot of that, and using other drugs that are non-narcotic based that actually can help the patient and not require as much, narcotics long term is amazing. And there's always constant changes with anesthesia practice. There's always new equipment, new devices, new anesthesia machines, but you learn as when you are in CRNA school, the bare bones of your anesthesia machine. The ins, the outs, the ups and downs of your machine. It's inside mechanically, like every single thing. And the physics behind it all. Why is it functioning the way it does? I know there's a lot more information you need to know right now, but you'll learn it all. So you can see a machine right here, and you basically will know, like, kind of like what's going on with it. If something's acting a little funky, we know all different type of checks to check our machines. Our anesthesia machine is basically our like life. Like, it's amazing. Like, it's awesome. And there's so many different types of machines that do all type of cool things, you know. And also the equipment you use, you know, different types of tubes, different types of, you know, anesthesia kits. I mean, there's all different types of drugs that you learn, and that you utilize when you're taking care of patients. So that's the nice thing about, you know, being a CRNA. You see so many different types of medications, all different types of management techniques. And for me, I love the OB population. I love placing epidurals, you know, C-sections, placing spinals, for example, and really managing patients during that period. I mean, I think it's a great technique to have, and that's one of the things I really love. So that's another thing, you know, you could specialize in a specific area. Like, I have some friends who love ENT and they love the pediatric population, and that's like your thing. And you can do that, you know. And if you like vascular, say for example you're a cardiovascular ICU nurse and you just love fresh hearts, you just love vascular cases, just your thing, you could become a cardiac CRNA. You can be that person giving the anesthesia for cardiac surgery. You know, you can be placing central lines, doing TEEs, for example. You can go ahead and do, it's a lot of multiple drips you have to deal with, you know. And the patient codes, you know, you do your ACLS type of thing. So definitely consider that when you are, why you want to become a CRNA, because there's so much things you can do. And say, for example, you work in a specific facility and you work, you know, general surgery, all different types of cases, but you really don't get OB population, like epidurals, for example. You can do a sidekick job and work at another facility and just do those all day, maybe once a week. Or maybe you want to work another job and do dental surgery, for example. Or maybe you want to do plastic surgery. There's so much options in anesthesia, which I love. You know, for me, you can't really get bored. If you're comfortable in a certain area, even as an ICU nurse, you get comfortable, you just got to change it around a little bit and switch it around, try something different, move around, you know. So you can do that same exact thing as a CRNA. That's why I love it so much. And of course, the people currently where I work, I love the people I work with. I love the anesthesiologists I work with. And the most important thing is your culture. You know, you may become a CRNA, you may be amazing at it, but the people you work with may not be that type of area or, you know, type of situation that's healthy for you. So, you know, I feel you need to be happy, of course, because you can be spending 40 hours a week, for example, in a facility. So you want to be happy where you're working. So even if you're a CRNA currently and you're unhappy, maybe change to a new job. Try another area, because I think it's an amazing profession. And, you know, it does take a lot of time and patience to become a CRNA, becoming a registered nurse, you know, getting your ICU experience, you know, make sure you're involved on your unit, applying to a CRNA program, getting accepted into a program, going through the program itself, and then working. It can be long, but I feel it is worth it, and I've chose this for a reason, and I'm so happy with that. And if you are in a specific area that you're kind of questioning, you know, reevaluate what you want to do in life and do a pros and cons list, see what weighs the best for you and figure it out and see what works best for you. But I love what I do, and I'm here to give you that information. So if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of these videos over here, and I'll see you in the next video. Thanks for watching.